I have a lot of patients, and probably the most common condition is pain. Pain from varied sources. Pain can be emotional, pain can be physical, it can be from post-trauma, so from motor vehicle accidents. It can be inflammatory pain from Crohn's disease or ulcerative colitis or rheumatoid arthritis. It can be neuropathic pain, fibromyalgia. Any sort of pain responds to cannabis medicines well. Not acute pain, so if you just cut yourself, cannabis is not going to help you relieve that pain, but chronic pain, pain that is still there months after the initial injury or the initial cause. So pain is definitely a main area, probably 60 or so % of my patients. I have a lot of patients with epilepsy, both adult and childhood epilepsy. The mainstay of treatment for that is CBD, though I do find a little bit of THC also helps in this area. I have a lot of ASD or autism spectrum children, ADHD, OCD behaviours. So a lot of developmental abnormalities and problems with children developing and behavioural problems. Anxiety and depression are two areas also where cannabis medicines can be very useful, though they should be used with care in these areas, as THC may increase anxiety. That refers to the bimodal effect of cannabis as a medicine. So that means a low amount may have a certain effect like euphoria or relieving anxiety, whereas a high amount of THC may actually increase that anxiety. So we have to be careful there. The range of ailments is very wide, and in Australia, where as doctors we're allowed to prescribe cannabis as a medicine when symptoms from any disease have failed to be treated by conventional medication or treatments. So although there's a sort of idea in our society that we can only treat chemotherapy-induced nausea and vomiting, epilepsy, pain, and multiple sclerosis with cannabis, while we can, and there are major areas of treatment, any disease which hasn't responded to conventional treatment is a potential area for a patient in my clinic. So I have patients who have chronic COPD or chronic obstructive pulmonary disease, difficulty breathing. So they use very small amounts of vaporized cannabis for bronchodilation to help them with their breathing. Not enough to get them high, but enough to open up their lungs and help them with their breathing. So that will be a more niche area or a smaller area of patients that I treat. The range of treatments for cannabis is almost endless. And at the moment, we're just still getting the studies done in the scientific community to prove the benefits where they've been anecdotally or just used in society for a long time. Cannabis medicines prior to criminalisation in the 20s and earlier were easily available over any pharmacy counter and were part of the doctor's pharmacopoeia. And they're re-emerging now in a strong way, so that's very good to see.